Let's make a start. I'll introduce myself just briefly. So my name's Karen. I'm the programme lead for Boost, which is the North East and North Cumbria's Learning and Improvement community. If you're not already a member, then feel free to jump onto the Boost website and sign up as a member, and then you'll get lots of information about any of our learning interventions that we might be doing and that are upcoming, including our lunch and learns. So here we are today. I want to introduce Vicky Strassheim, who's here and is going to hold court and deliver for us today First Contact Practitioner Opioid Awareness video tool, along with some colleagues who are here as well. We do record, so if you invite you to keep your cameras off, definitely eat your lunch, because this is a lunch and learn, so feel free to eat your lunch and enjoy the presentation. There will be an opportunity to ask questions towards the end of the session. We'll definitely finish by 1:30 today. So just you can see there from the slide that this is our lunch and learn session. We're always interested to hear from people who work in the health and care space. If you're interested in sharing anything really that it cuts across health and care for our region especially. So do get in touch if there's something that you think might be of value for us to be able to promote through lunch and learn. Just some quick protocols there. Obviously I won't read them out to you. We are recording, like I say, and so there'll be an opportunity to see this back, but also to share with any colleagues that that might want to see it that have missed it today. So what I'm going to do now is hand over to Vicky for the rest of the presentation.
Thanks, Karen, and hello everybody. So I'm here from the Health Innovation North East North Cumbria. I've got a couple of colleagues on the call. I've got Helen Seymour and Emily Wales and Yo-Yo, who've all had a part in the creation of this tool. Hello, there's Helen waving. So I'm going to talk to you about how the FCP Opioid Awareness Resource Tool came about. So have the next slide, please. Thanks, Karen. So this is the opioid data from the region. Next slide, please. So I'm sure a lot of you have seen this data. So these are the prescribing trends across the region for the last few years, and we can see they're all coming down. But Health Innovation North East North Cumbria and with their patient safety collaborative work were given the prioritisation of trying to support the opioid deprescribing across the region. We've done quite a few different projects in this area, and in 2022 we had an event called Feeling the Pain, and a gentleman came and spoke called Deepak Ravindran, and he was very keen on the approach we were taking, this holistic whole systems approach that we were taking when it came to opioids. And he said something really quite profound when he said we need to have lots of these conversations happening across a health ecosystem. It can't just come down to the pharmacists and the GPs. It's the same message from the same people. We need to get that message out, and sometimes it takes 6 or 7 times that message has to come from various different clinicians before a person might then start on their journey for change, in that cycle of change, go from pre-contemplative to contemplative and then take action. So this is where this work came around. And also with the understanding that we had the first contact practitioners who've got various different professions linking into them, but physios are a large part of that profession, and they have conversations about pain and about drugs regularly. And in 2022, we evaluated to understand what their confidence was like in order to have a conversation just about opioids. So if I can have the next slide there, please. So on the back of the evaluation in 2022, we discovered that FCP physios weren't particularly confident to have a conversation about opioids, happy to take a drug history, but then were concerned about their patient relationship and whether or not they were going to harm that relationship they had with the patient by broaching something as sensitive as their opioids. So in conjunction with a couple of SCPs and a medicines optimization pharmacist, we developed this tool, and this is it now. So Karen, if you'd like to play this now, and then we can have a discussion afterwards.
Opioid Awareness Resource Tool. Opioids such as codeine, tramadol, morphine and oxycodone provide effective pain relief for acute pain and in end-of-life care. New understanding suggests opioids do not often work for chronic pain. The ask. It is important that all healthcare professionals understand that opioids should be taken for the shortest time possible. First contact practitioners are key to support a whole systems message to reduce inappropriate opioid use. This video provides information about the risks and harms to people taking long-term opioids for non-cancer pain. It introduces how to have effective shared decision-making conversations about opioids with patients, and where to signpost patients if they wish to explore a dose reduction. Why are opioid conversations so important? Opioids were involved with over 2,000 drug poisoning deaths in 2021. Deaths associated with tramadol and codeine have been on a gradual increase since 1993 in England and Wales. It is important that consistent messaging is building across the healthcare system. Risks from opioids for long-term pain. All opioids come with associated risk. However, with increasing doses and additional medication combinations, these risks rise, often without a corresponding improvement in pain relief and quality of life. Primary care prescribing can impact on high use of opioids. For example, patients can request more analgesia if they don't know the expected duration of pain or what to do if their pain doesn't improve. Potential harm for long-term use and some side effects of opioids are well known by patients and include constipation, nausea, and drowsiness. Some lesser-known long-term harms develop gradually and are shown on the screen. It may be appropriate to gently introduce these lesser-known side effects to the patient, as they may not associate them with their opioid use. Initiating a conversation. It is important that health professionals understand the effects and impacts of opioids. However, this information will need to be applied to the patient and their biopsychosocial circumstances. Initiating a conversation on reducing opioids can be difficult, but every contact counts. Explore if the patient would like to know more, and if they agree, here are some questions that you might find useful. The response to these questions indicate whether a conversation about opioid prescription review with an aim to reduce is appropriate. Withdrawal symptoms. Reducing long-term opioids can worry patients because of unpleasant withdrawal symptoms, shown on the screen. These symptoms are rare and temporary. The patient can be reassured that the reduction process can be slowed down if they are experiencing withdrawal effects. The medication should never be stopped abruptly, and a shared decision approach with their GP or pharmacist should be adopted. Support can be found through family and friends. Social prescribers can help pain management too. Any conversations about the opioid prescribing should be documented in the patient notes. Summary. Opioid reduction may require a joined-up working with the wider multidisciplinary team, social care, and third sector. Inappropriate opioid prescribing is a large NHS problem. Your help to reduce the impact of opioids on patients' lives is crucial.
Thank you. So we launched that video at a webinar aimed at FCPs in April. And we had 361 people register for that event and 199 turned up. We'd never been so popular. We don't normally get that many people to the events that we run, but with the help of the North East Musculoskeletal Society, they publicised they had really niche contacts, so we could get to the people who we'd wanted to see this video. So it's predominantly aimed at first contact practitioners. So we can see here when we evaluated pre and post, we got an improvement. So I feel that I'm confident to have a conversation about patients' drug history. Most people were confident enough to have that conversation, but watching the video, that changed and it improved. I feel I'm able to identify when there's an issue with opioids. Again, that improved quite a lot. And then finally, I'm confident to have a conversation about opioids with the patient. And as you can see with the model conversation, it wasn't a successful outcome depending on how you look at it. The patient didn't want to do anything. He didn't want to be signposted. Oh yeah, I've been thinking about that. I'm going to come down on my opioids. Yeah, what do I do? Tell me what I need to do now. It was more, the success was the conversation had been had. It had planted a seed with that patient and they're going to go away and think about it. It wasn't the right time for them. It has to be the right time for them. It's a very personalised care approach. And we tried very hard to bring that personalised care approach into the video. So next slide, please. So again, the next, what we asked after we showed the video at the webinar was, what's the likelihood of having a conversation about opioids with the patient following the video? And you can see that the likelihood increased. More people were likely to have a conversation, and that's all that we wanted the video to do. It was just to start building that confidence across the ecosystem, that if more people are having these conversations, the message is going to get further, and it's not just going to be coming from the same people all the time. It's going to be coming from different perspectives, and hopefully planting that seed and letting it grow a little bit. So next slide, please. So around this video footage, we have created a healthcare professionals opioid awareness resource. So there's a link on the video, and I'm sure we can share that. Within that resource, we've got the link to the video that you've just seen. We've also got Mark's story, who is a gentleman called Mark, who has been on opioids for 25 years, and he shares his story on that. We've got Deepak talking about how to build a message across the ecosystem and how to take a holistic approach. And we have an FCP and a medicines optimization pharmacist will be talking on there very shortly in a podcast that we recorded in February. So that information will be coming up. So we're building those resources there on that website. Then we also host the NHS Futures platform for the North Cumbria Community of Practice. Now on there we have the recording of the webinar that we held in April for the FCPs. And within that, when we launched, we also had a panel discussion with Graham Sayers, who is the chair of the Clinical Pain Network, an FCP, Carrie-Anne Kirkup from Brampton, and a medicines optimization pharmacist, that was Katie Meller, again from North Cumbria. And then finally, we had a patient with lived experience, Katie Wooten, and that's all recorded and uploaded onto the Futures platform if anybody would like to join that platform and go and have a look at it. And I think that's my final slide. If I've got any questions. Yeah, so I'm happy to take questions if there's any, if there's any in the chat. Sorry, I can't multitask.
Yeah, fine. Well done. Thanks, Vicky, so much. So would invite anybody to contribute, any of Vicky's colleagues, or if anybody's got a question. We've still got a few minutes left.
I will say we've got plans to, the SCP isn't particularly mentioned. I think it's mentioned once in the narrative and once on the script, on the slides, and we're hoping really this information can go right out across. You know, it's relevant to all healthcare professionals, so we're hoping to adapt the video footage for healthcare professionals, and then we're trying to work out whether or not we can adapt it for health champions so it goes to lay people as well. So we'll see if we can do that. Oh,
good stuff.
No questions.
So just want to give anybody an opportunity just to jump in before I wrap up. Any questions or comments for Vicky?
I think Helena's just popped in. Hi, Vicky. Do you think this would be a good tool for universities as well as for prescribing courses? Yeah, I think it would. So we're already talking. We've got links into the medical undergraduates. I'll have links to physio, definitely Northumbria, potentially at Teesside, and then also to prescribers, so to pharmacies as well. So we have got plans to get that out. I think we're going to have to adapt the footage so it doesn't say FCP, otherwise it might get, but I think healthcare professional covers everybody. So if we can get that altered, it's just we knew we'd evaluated the FCPs and we wanted to see what the changes might be, and we know that now. So yeah, I hope that answers your question, Helena.
Great, thanks, Vicky, and thanks, Helena. Any other thoughts or questions?
Oh, there. So yours popped in the chat there. The links to the resources, so they're all in the chat.
Fantastic. Great. So loads of resources there. Like I say, we have recorded this as well. So keep an eye out on the Boost website and you'll see the link through that and social media to the YouTube channel, obviously, to be able to see that again. And the video is really good and informative too. And obviously we can push that out separately if we want to. A couple of additional things in the chat there. Our next Lunch and Learns are coming up and are just there in the chat on the 28th of June and the 10th of July. We do always try and get some feedback as well on all of our sessions, so there's a link in there too. So I just want to say thank you again to Vicky for today's Lunch and Learn, and thanks everybody for coming along.
Thank you.